I co-founded the Center for XDP at Mass General after we discovered that my brother has a disease known as XDP, which is short for X-linked Dystonia-Parkinsonism. XDP is a hereditary brain disease affecting people from the Philippines. It is a rare condition that combines features of two common movement disorders, dystonia and Parkinsonism, and involves a progressive loss of neurons in the brain, especially in an area called the striatum. At the time, the cause of XDP was not known, and there were very few available treatments. So we set out to create this organization that would bring experts from around the world together to solve this disease.
Over the past 10 years, the Collaborative Center for XDP has grown to become a global coalition of basic scientists, clinicians, and patient advocates across North America, Europe, and the Philippines. And our research portfolio now consists of both academic institutions and industry partners performing a broad range of basic and clinical studies that are all focused on finding a cure for XDP.
The process of developing new treatments for genetic diseases requires the cooperation of lots of people. It involves patients and their families who volunteer for research, the clinicians who evaluate them and collect blood and other kinds of biospecimens, and all of the scientists who study these materials in the laboratory. It is a huge community effort, which is why the Collaborative Center for XDP has built a large network to connect all of us.
Our progress in the lab also depends on the cooperation of many different kinds of scientists, including geneticists who analyze DNA sequences, the biologists who create new cell and animal models, and the computational experts who develop methods for mining extraordinarily large data sets. At the Collaborative Center for XDP, all of these people are working together in our large and interdisciplinary teams, developing novel technologies to discover disease mechanisms, as well as targets that could be the basis for new therapeutics.
While our scientists are studying the causes of XDP in the laboratory, our clinicians are working equally hard to understand the different symptoms that XDP patients experience and how we can best treat them using existing medicines. Because our ultimate goal is to develop new and better treatments, our clinical team is also studying how we can quantify the symptoms in XDP individuals so that when our scientists identify new drug candidates, we have measures that can be used to determine their efficacy in clinical trials.
In addition to our research mission, we are also committed to improving the lives of individuals with XDP and their families. To do that, I also founded the Sunshine Care Foundation, which is CCXDP's primary partner in the Philippines. Our team includes movement disorder neurologists, genetic counselors, nurses, support staff, and dedicated community advocates all working together. We offer comprehensive medical care to XDP patients and a range of support services to their families, as well as an infrastructure that facilitates the clinical research studies conducted by our investigators.
Our coalition of scientists is committed to our mission of finding a cure for XDP and to our shared belief in the value of team science. We think that people working in teams can accomplish more than when they work alone, and we believe that the most successful teams are ones that bring together individuals with diverse expertise. So if you are a scientist with a creative new idea, or a patient family asking how you can contribute, we want to hear from you. Learn more about what we do on our website and how you can get involved, because together, we will solve this.
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 Join me in my mission to find a cure for XDP, because I truly believe that together we will solve this and we will find a cure.